Hello, I'm Colleen Kummet. I'm an epidemiologist and director of health analytics here at GDIT. With the increasing rising costs of healthcare in the U.S. today, technologies like AI present real value in solving these issues. Today, I have some leaders from GDIT who are implementing AI solutions to address these issues, from reducing provider burden to allow more time to be spent with patients during an appointment, to applying AI to speed medical research and diagnosis, and the identification of fraud, waste, and abuse for cost savings in healthcare. I'm joined today by Karen Painter. Would you introduce yourself and your role here at GDIT?
Sure, great. Thank you, Colleen. So I'm Karen Painter, and I am a program director here at GDIT, and I support CMS, the Center for Medicare and Medicaid Services, and their mission of program integrity to detect and prevent potential fraud or abuse across the Medicare, Medicaid, and Marketplace programs.
Hi, I'm Paula Harper. I am a senior director here at GDIT, and I am the program manager for the largest federal financial system in the federal government. And we make sure that all of our Medicare and Medicaid beneficiaries receive their payments every month.
And I'm Shelley Butler. I'm a director here at GDIT as well. The programs that fall under my portfolio are for digital transformation work we are doing for the Department of Veterans Affairs.
Thanks, Shelley. And you just had a recent hugely impactful AI implementation to address a need for veterans in Puerto Rico. Would you tell us more about that?
Absolutely. So the challenge that we were presented with are these letters that are being mailed out by the Department of Veterans Affairs to veterans, their dependents, their family members all over the country. We mail about 50 or 60,000 letters a day, and a good portion of those go to Puerto Rico. These letters are in English, so you can imagine the folks in Puerto Rico might prefer their letter to be in Spanish. So we implemented a solution that used several AI tools. We used large language models and intelligent document recognition models to translate these letters from English into Spanish. Now, you would think, how hard could it be to translate English into Spanish? But Spanish is 20% longer in characters than English, so it changes the format of the form. There are also requirements from our customer to translate certain things and not others. Dates and financial information needed to stay not translated. So we had to use these models to detect those parts of the form that should be translated and other parts that weren't, reformat it so it still all fit within the page. So instead of these veterans or their family members having to travel long distances to get to their regional office for translation services, some of them had to travel 4 hours or more and wait in long lines at the regional office. Now those waiting rooms are empty.
Excellent. So that's a real impact to veterans in Puerto Rico. Thanks for sharing. Some of GDIT's largest programs support the Centers for Medicare and Medicaid Services. And from managing the largest financial accounting systems in the federal government to the largest cloud implementation in the federal government. Protecting the Medicare Trust Fund is central to their mission at CMS. Karen, can you talk to us about your team's fraud, waste, and abuse work at CMS and how AI is central to that?
Absolutely, yeah. So you're right. So we support CMS, their oversight over, large programs, Medicare, Medicaid, and the Marketplace plans. Medicare and Medicaid alone have expenditures more than $1.4 trillion annually, so it's a huge scope. And a lot of the work that we do involves a lot of advanced analytics. And so we have really seen a tremendous amount of benefit over the past few years using some of the modern techniques around AI and ML in particular. With machine learning models, we've really been able to expedite the analytics that we're able to create, improve the performance of the models that we're generating, and save CMS a lot of money in the work that we're doing. We identify hundreds of millions of dollars of fraud annually, but we have seen the performance of our models that have been developed using machine learning techniques have outperformed and had better performance than some of our traditional models that take more time. So it's really exciting, the work that we're doing.
So efficiency and better outcomes using AI.
That's right.
That's
yes.
Amazing.
Yeah.
Paula, you lead the largest financial management system in the federal government. Can you talk to us about some opportunities that you're piloting AI in the financial system?
Yes, our system has been in existence for 20 years, and they'll be reaching its anniversary in 2025. And so you can imagine the amount of data that is contained within our system, as well as the legacy of CMS leaders who have managed that system over 20 years. And so our customers' concern was that their workforce was reaching retirement age and that they would be losing all of that knowledge. And so the use case that we piloted was to allow the CMS community to retain all of that knowledge and intellectual information. So we have thousands of documents and different artifacts where we're using artificial intelligence to bring that data into one environment, and so that someone who's not been with the organization as long can still have that legacy information available to them. And it is significantly working or looking like that data will be able to be analyzed and compared in significantly shorter periods of time than trying to sit down and obtain that knowledge from an individual.
So maintaining and building on that knowledge of the retiring workforce into the new hires.
Absolutely.
That's fantastic. One important part of successful AI implementation is the idea of a human in the loop. That a person in the end makes a decision alongside of the AI technology. Keeping a human in the loop allows for some key features to augment AI. It provides key oversight of AI systems, key validation of what the AI systems are producing, and also helps to mitigate bias and increase trust in AI systems, ultimately leading to more reliable and trustworthy decisions that are more efficient than manual and semi-manual methods. As you are implementing your solutions, how do you find that right balance between engaging AI and the automation that it provides and still keeping that human in the loop for that AI system? Shelley, let's start with you.
So the human in the loop that we are using in the translation of our letters has to do with certain terms. There's a lot of medical language that's being included in these letters. We need to make sure we're translating it to the right Spanish version. So we have folks on the team that are reviewing those translations, making sure they're appropriate. And then that feeds back into the model, which is a huge benefit. Same with the reformatting I mentioned before. When we have to translate certain parts and then it gets to be much longer on the page and we're reformatting that. When we recognize new components of letters that we hadn't seen before, we want to make sure it reformatted properly. And again, that's fed right back into our models, so they're continuously learning.
Great, thank you. Paula, what does human in the loop mean in your
For us,
projects?
because it's a financial management system, while we're using AI to compile the data and store the knowledge, there's still the human factor of making sure that the numbers that the AI model is translating and capturing actually make sense, that they add up, and that they are truly reflective of a policy or an artifact that's critical that may have to be reported above our agency. So we definitely still have a subject matter expert review that information for accuracy.
Thanks, Paula.
Sure.
Karen, what does this mean in fraud?
Yeah, absolutely. I mean, responsible AI is so important. And our customer, we implemented our first machine learning model in 2019, and we've been really incrementally building new technology, proving out the capabilities, demonstrating the effectiveness of the work, but absolutely still always have humans in the loop. We have subject matter experts also who help to develop and design our models and also help to test and validate. But another key component is all of our analytics get fed to other teams that may pick up those investigations. And one of the key features that we've incorporated is what we call explainability. So making sure that we have a lot of transparency and explainability in the work that we do, so that our end users can understand, right? We don't want a black box solution. And so even though we have some advanced analytics going on, within the system, our reports and dashboards that we present with our models lay out all the information so that everybody's able to see why maybe a subject or entity alerted, why they looked like an outlier or anomalous compared to their peers. So critically important, and everything, all the machine learning that we use at CMS absolutely has a human in the loop, to validate that information.
That's great.
Yeah.
So you're combining the human in the loop for the trustworthy component and the explainability for the transparency component in your final AI solution.
Yep, that's right. Yep.
Great. Federal agencies have been early adopters of using machine learning and AI solutions for their missions. What advice would you give other agencies that are considering operational adoption of AI? Shelley, what about you?
I know the challenges that our agency has faced is finding the funding and the contract to, add the work to the solutions that we're providing. So sometimes you have to get a little creative in advancing the scope of a contract to include these kind of capabilities. And I know there's also challenges in distinguishing mission or agency funding against OI&T funds. And a lot of times AI is just stamped an IT function. For us, it's not. It's in the mission. So we're able to provide it more as a managed service so they don't have to secure special funding for that.
Thanks, Shelley. Paula, how about you?
For us, for my customer, the most important thing was becoming knowledgeable about AI and not jumping in, full force. So we conducted a pilot, and it really gave my customer the opportunity to understand the possibilities of it, as well as understand the terminology of it and what things really meant. It was a tremendous learning experience for our customer and for my staff in helping us build additional use cases of where we would see the value of AI.
Thanks, Paula. Karen?
Yeah, I agree. I mean, I think the iterative approach has been really effective for our customer as well, being able to demonstrate the value in the work that we've done, being able to, bring in very specific use cases that align to our customers' needs, right? There's so much broad discussion about all the capabilities with AI and ML, but when we were able to, find a real use case that was applicable to our customer that we could demonstrate, could increase value, increase efficiency for our team, it made it much easier for our customer to be willing to allow us to move that forward into production. So that's been key for us. And I also think, though, too, being aware of all of the risk that comes along between security risks or bias, the transparency. So, it was really a combination of both, right? Our customer was hearing some of these concerns on one end, and so we couldn't bring a solution in without addressing those concerns, and how we've been able to mitigate those concerns as we've developed our pilots and use cases. So
it's not just the technology itself, it's the surrounding governance and implementation and the bias mitigation as well.
Yeah.
As we wrap up, I'd like to explore what's next for AI in the federal health space. I see opportunity in continued image analysis, text and language analysis with the advent of generative AI. Shelley, what's next for you and your customers?
So some of the other areas that we are starting to explore with the VA have to do with process automation. We have a lot of incoming mail too, not just outgoing mail, but we also have a lot of claims that are being processed. At the end of the day, the veteran affairs employees have to be the ones that make those decisions, like we were talking about before with human in the loop. But there are a lot of the steps that they're taking to get to those decisions, the processing of the mail, that can be automated. So that's a big area we're continuing to explore.
And a potential for cost savings too.
Yes, yes.
Paula, what about you?
For us, our financial system processes 4.5 million claims a night, which equates to $1.2 or $3 trillion annually. So we're investigating using AI to help us more proactively detect anomalies in those payments so that on the end of the transaction, we'll hopefully be able to spend less time analyzing manually what the anomalies are versus having the ability to have that information before we start processing that significant number of transactions. So that's one area that we're really excited about. Not only will that save time, but ultimately will save payment and our ability to get these payments to our beneficiaries much quicker than we have been before.
Excellent. Thanks, Paula. Karen?
Yeah, I mean, the possibilities are endless. I mean, really, it's so exciting to imagine the future. Gen AI techniques, I mean, are still, being explored, consumed, adopted, within our customer. We are actively working on pilots and use cases today, actually, using Luna AI. We've just recently tested a pilot of, the text analytics and using that as an ability for our team to spend less time researching, like you said, the heavy policy that goes along with, Medicare guidelines, Medicaid guidelines, marketplace guidelines. So that's definitely one area that we're exploring actively. But code generation is another area, right? Gen AI, it generates new content. A lot of the work that we're doing, we're creating code. And, so that's another use case that's exciting to see. Again, can we continue to build our efficiencies, develop good results for our customer using the technology? So I'm excited. I think there's countless opportunities out there and, just trying to dig into the ones that we think will have the most impact for our customer.
Yeah, absolutely.
So, yeah.
And building off the code generation, code translation as well, as we modernize
100%.
our code bases, as our systems modernize as well, translating code from older softwares to newer softwares.
100%. Yeah.
Karen, Paula, Shelley, thank you so much for joining me today and talking about the important work you're doing implementing AI solutions for our federal health customers. I look forward to all the exciting and new opportunities we'll have to work with our clients with their new AI solutions. To hear more about GDIT's expertise, please visit gdit.com/perspectives.